Let's talk about how to regulate glomerular filtration rate, otherwise known as GFR. In our previous two videos, we talked about GFR and we talked about the driving pressure moving substances from the blood plasma into Bowman's capsule, creating the filtrate. Those two parameters are intimately tied to each other. GFR is going to determine or impact the driving pressure. And like we said previously, GFR needs to be tightly regulated around 125 milliliters per minute. So by adjusting or manipulating the size of the afferents or efferent arterioles, we can, or the body can, dictate how much blood volume is moving into the glomerulus. And as a result, that volume is going to be directly related to pressure and then GFR. So let's take a look at this. If the body were to cause vasoconstriction of the afferent arteriole, right in this region here, we're going to get an increase in blood pressure. And because blood flows from areas of high pressure to areas of lower pressure, now that there's a higher pressure here, there's going to be less blood flow into the glomerulus. And with less blood volume moving into the glomerulus, we're going to decrease pressure. So if GFR is too high, vasoconstriction of the afferent arteriole will decrease GFR, hopefully back down to the appropriate level of 125 milliliters per minute. Once again, the vasoconstriction is going to increase pressure here, which will minimize blood flow into the glomerulus. Now, if GFR is too low, we can vasodilate the afferent arteriole. By vasodilating the afferent arteriole, we're increasing the volume of the container, which will decrease pressure and increase blood flow to this area. By increasing blood flow to the area, we're going to increase plasma volume, which will increase the pressure and, by corollary, increase GFR. So an increase in GFR can be modified by vasoconstriction of the afferent arteriole. A decrease in GFR can be modified by vasodilation of the afferent arteriole. Now, the afferent arteriole is the main means by which GFR is regulated, but theoretically the same can happen with the efferent arteriole. If GFR has diminished, the vasoconstriction of the efferent arteriole causes an increase in pressure here, where less blood flow is going to be able to flow through the efferent arteriole. And as a result, this is going to function somewhat akin to a dam, where fluid starts backing up into the glomerulus. We get an increase in volume of that fluid and a corresponding increase in pressure to bring GFR back to the appropriate level. If we vasodilate the efferent arteriole, that's going to decrease pressure in the efferent arteriole and increase blood flow out of the glomerulus. And that would be a method by which GFR can be diminished. I should say that'd be a way to decrease pressure when there is elevated GFR to bring GFR back to an appropriate level.